Good evening, everyone. Thank you so much for being here in person and online. We are grateful to be hosted again at St. A discussion on sexually transmitted diseases, HIV, COVID-19, and pediatrician at Wake Med Health and Hospitals. So we all know that since late 2019, dealing with the COVID-19 pandemic, it's caused many problems in healthcare and economies and people's everyday lives and all over the planet. We know that it's important to stay up to date on the latest information from COVID-19, how it spreads, how vaccines help, and what public health measures we can do to help keep safe families and communities. Additionally, in recent years, sexually transmitted disease significant impacts on individuals, communities, and global healthcare systems. Understanding crucial for our pursuit of well-being and public health. Sexually transmitted diseases, they affect millions of people worldwide. HIV continues to be a global pandemic with approximately 38 million people living with HIV around the world. 690,000 AIDS-related deaths occurring each year. While substantial progress has been made in terms of treatment and prevention, the continued need for advocacy, support, and research remains essential. According to data in 2021 in North Carolina, the annual HIV report, there were almost 3,800 people living with HIV in Wake County in 2021. Additionally, there were 16.8 newly diagnosed HIV cases per 100,000 residents, or 162 cases in total, in Wake County, which is higher than the state's average. That 2021 STD surveillance report also found almost 6,000 cases of chlamydia, 2,400 cases of gonorrhea, and 360 cases of syphilis in Wake County in 2021. It shows that the rate of infection per 100,000 residents is greatest in areas with the highest percentage of residents living in poverty. And for chlamydia, gonorrhea, and syphilis, 100,000 individuals is highest amongst Black or African American individuals across all genders. And this year, between January and March, we saw an increase in across all cases. Chlamydia was reported the highest with 1,200 cases, with 308 cases of gonorrhea reported. In order to address this issue, the Wake County Public Health Department was working closely with healthcare providers, community partners to provide education, information to monitor and address the cases of HIV and sexually transmitted disease. They're committed to providing resources and expanding treatment and testing in the county. We are here today to talk about all of the above. We may also have time to talk about RSV as we enter our flu and RSV. So I'll start by introducing my panelists. Here today in person by our longtime co-host, introduce yourself.
Thank you, Dr. Monroe. I'm Stefanie Etienne, and I'm a family physician. I've practiced in the Raleigh area for about 18 years now, and in particular in the Southeast Raleigh community. I work for the Wake County Health Department in Wake Forest, as well as here in Southeast Raleigh, providing care for pretty much patients of all ages, children, adults, providing prenatal care and planning services, and also STD services. I worked alongside Dr. Monroe throughout the pandemic in this community, ensuring that people of color, particularly African American and Hispanic, people who were less likely We want this to be a dialogue. You all have questions, please ask. We're here to get information, and we have a lot to share with you today.
Dr. Etienne, every time you remind me of the work that we did together with several other people I see in the audience. Every time you remind me of that work, it seems like it was so long ago. It was in 2021 when we were doing our trying to reach the community. And I am asked frequently, what are we doing these days? Boosters coming out, there's an RSV vaccine, and where is the Sister Circle and the health equity team of volunteers? And so we just want to get the information out, let people know where they can get the up-to-date vaccines and best information. And that's the way in which we are trying to help our community at this time. So remind in a couple of years. We are joined online by nurse practitioner Kendra Dennison. And I would love for her to introduce herself in sexually transmitted disease prevention and treatment. And we would love for her to introduce herself before we get started.
Hi, thank you, Dr. Monroe. Like she said, my name is Kendra Dennison. I'm a nurse practitioner. I have been working at Wake County Human Services in Clinic A, which is our STI clinic. I've been there for almost 9 years now, where I test or retest and treat for multiple sexually transmitted infections. We also offer services for HIV prevention, PrEP, and post-exposure prophylaxis for HIV prevention. We also have Hep-C treatment as part of the services that a provider provides also in Clinic A at the health department.
Excellent. Thank you so much. If you are listening online, if you are joining us via Facebook or YouTube, thank you so much. Please do put in the chat. They will be shared with us and we will make sure that we answer those questions. If you are joining in person, we appreciate your attendance and we'll open up the floor to you soon to have the opportunity to also ask questions. So Kendra, I'm going to get started with you. Remind us, we're talking about STDs, including HIV, the virus that causes. We're talking about the uptick that specifically is disproportionate to communities of color or communities who have higher rates of poverty and overlap. We understand due to historical factors that shape those communities. What is the overall message? What do people need to do? The rates are going up. People want to stay safe. What do people need to do to keep themselves safe from sexually transmitted diseases, including HIV?
One of the easiest ways to prevent transmission is by using condoms. Outside of using condoms, people also can reduce their risk by limiting the number of partners that they are sexually active with. Also, knowing your status, making sure you're tested and anyone that you have sex with is also tested.
Excellent. It really comes down to what we've been saying for decades now, doesn't it? About making safe choices around sex. I remind them using using condoms with every partner every time, because the intermittent or occasional use of condoms is not sufficient. Making sure they're putting on condoms correctly, and we will practice with that in clinic. Making sure that they are putting on condoms correctly, which you can YouTube if you are not sure how you should do that. And then I like the point you made, nurse practitioner Dennison, about knowing your status and getting your partner tested. I always say to my teams, if we're ready to make the big adult decision of being sexually active, then we need to be able to have the conversation with our partner about getting tested together, right? Make a date of it. Come into the clinic and get tested. And again, that test is one point in time, right? It doesn't tell us what happens 24 hours later, a month later. But getting tested, knowing your status, making sure you know the status of your partners is really, really important. Awesome. Thank you so much for that. Please,
Really quickly.
go ahead.
We talked about condoms can be very expensive for some, I know. But if you're going to be sexually active, even if you have one partner, if you're having sex, you should have access to condoms. You can get condoms for free at any of the health department offices. The main, that's not very. You can go to the front desk and discreetly ask for them, and they will give them to you for free, as many as you, often as you need them. So there's really no excuse to say, oh, I have to get the condoms, I couldn't afford them. They are there, and it's good to have them, even if you're not to have them in case you decide one day that you want to have sex, or if you have a friend who needs one all of a sudden. Things happen, it's better to be prepared.
Nurse practitioner Dennison, I want to go back to you. You're seeing patients, treating the community. What specific groups or demographics does the data show are at higher risk for contracting sexually transmitted diseases in our area, and how do we go about addressing those disparities?
So obviously anyone can contract an infection if you are sexually active. So that's important for everyone to understand, because I see patients who believe that they are at less risk. But I try to get patients to understand that it only takes one time to come in contact with an infection. But in general, we do see higher infection rates, specifically syphilis and HIV in men who do have male partners. Mostly of the highest rates are seen in Black or African American males. But it's, like I said, it's important to know that we see a variety of patients in the clinic, and it does not exclude other groups who think they may not be at risk because of their demographics or because they have less partners. So as far as meeting the needs of those individuals, it's important for people to have access to testing, for people to not feel embarrassed or ashamed to come to the clinic for those tests, and for us to make everyone feel welcomed when they come into the clinic for testing. But in general, we are seeing younger males, like I said, mostly men who have sex with men in that HIV, syphilis group, gonorrhea, chlamydia. We are seeing it a lot in Black or African American females and males also. But we do need to address things that put barriers in the way for people getting tested, or the information and the knowledge that people have that feel like they do not need to be tested, or they do not feel like they're at risk for contracting an infection.
Thank you for that. I remind our that HIV, AIDS, gonorrhea, syphilis, it looks like me, it looks like you, it looks like anybody. You can't look at someone and tell if they have sexually transmitted diseases or if they're at risk. You can't look at their private parts, or their genitals, and tell if they have a sexually transmitted disease. It's prudent, it's wise to always be protected. Partners tested, because though there are risks, there are groups that have higher risk. Everyone is at risk. So you talked about PrEP. You mentioned PrEP. Tell us a bit. What is PrEP and PEP, post-exposure prophylaxis? Tell us about those two things and who should consider them.
So PrEP stands for pre-exposure prophylaxis. There are 2 oral options for PrEP, and there's also an injectable option for PrEP. Our clinic does offer those options, except the injectable currently. We do offer the oral options in our PrEP clinic. That medication to prevent HIV can be used by anyone who feels they're at risk for acquiring HIV through sexual contact. Also, we offer PEP services, which is post-exposure prophylaxis. There's medications that people can take within 72 hours of possible exposure to HIV that prevents them from becoming HIV positive. That service is also offered at the Wake County Health Department. And PEP can be used by anyone who is at risk. They do have to be HIV negative. But it can be used for anyone who is at risk for acquiring HIV, as long as it started within that 72-hour window. So those are the 2 prevention options that we offer at the Wake County Health Department. And like I said, there is an injectable medication that's available, but people can find that available in the community, but we don't currently offer that service at the health department in Clinic A at this time.
Okay, so this is excellent information. And a lot of people might not know this, so I'm going to reemphasize it. Thank you for sharing it with us. So you're saying that if people are in a high-risk group, there is a way, or feel like that they're at risk for contracting HIV, there is a medicine that they can take by mouth, you said oral, so by mouth, that can help prevent them from contracting HIV. Or they can take a medication if they feel like they've had a high-risk exposure, protected sex, and feel it was a high-risk exposure. Within 3 days, if they start this medication, it can help prevent them contracting HIV if they were exposed. That's a big deal. That's a big deal. And I want to make sure that we all know and understand that. And Nurse Practitioner Dennison, are those free through Wake County?
The service the service itself is not free, but we can get the medications at no charge for the patient. Currently, we offer that service the PrEP service we offer for $48 every 3 months. The initial PEP appointment is also a $48 visit initially. And then if someone wants to transition from PEP to PrEP after they finish their regimen, we can also assist them with that. So for $48, we can see someone for those PrEP and PEP services and get the medication through patient assistance from the pharmaceutical companies at no charge to the patient.
That's fantastic. Regarding HIV and treatment, so, you've been practicing medicine for quite some time. You just told us, Dr. Etienne, I'm not going to out you and tell your age or anything, but there's been a lot of advancements in the treatment of HIV to the point where, as physicians, we think of HIV as a chronic disease, one that you can live with and live a full and healthy life with appropriate treatment. What does that look like these days as far as opportunities for HIV treatment?
Thankfully, there have advances in the options for treatments that are available and effective treating HIV. As we know, there is no cure for HIV, but these treatments improve the quality of life, it decreases the severity of the disease, as well as complications that can develop from HIV. Previously, we were limited in the number of medications that we had available, and people had to take so many pills as part of their treatment cocktail. So many people may not have been very compliant with treatments. Now there are treatment regimens that involve only a few pills that are easy to take and have less side effects. So they are people. Unfortunately, the number of HIV cases are still going up. And just because there are treatments, it's still not something that we want to take for granted or take lightly, because there are still complications related to HIV. Yes, you may not die of AIDS, like many people were dying of AIDS. We're not seeing that as much, thank goodness. However, there are still complications related to these. So that there are better treatment options, but you don't want to have to take medication for the rest of your life to keep those symptoms at bay.
You know, I want to talk a little bit about the stigma from an online participant asking about how often one should get tested, and just the fact that we're even having this conversation open really makes me happy. There has been in the past and continues to be such a stigma around talking about AIDS and getting tested and treated. I have a close family member who about 15 years ago died from AIDS, and no one knew at all that they were sick. It wasn't until probably last week of their life that we even knew that that they had been sick, and then eventually died from AIDS because there was such shame and stigma associated with even talking about the disease and the diagnosis. And so it's an important conversation that we're having here. I appreciate everyone being here for it. But when we're thinking about how often one should get tested, nurse practitioner Dennison, what are you advising to the people that you're seeing about the frequency of testing?
So anyone who's sexually active and even if they have one partner should at least get tested once a year. People who have multiple partners or are in higher risk groups, the patients that I see in those higher risk groups, because of the number of partners they're having, they're using social media to meet partners, maybe having anonymous sexual partners. I do recommend them coming in every 3 months for testing. Obviously, anyone who has symptoms should come in for testing also. So people in the highest risk groups, I recommend testing every 3 months. And then if someone is sexually active, even if they have one partner, should get screened at least once a year.
I'd like to add to that as well. STD testing is free at any health department. So the Wake County Health Department, of course, is what's closer to this area, but all counties have a health department, or if they don't have one, they have one close by. You can make an appointment. Services are anonymous. You don't have to worry about your aunts or uncle or someone seeing you go in. Everything is confidential, and it's free. So please take advantage of the opportunity to be tested. And I would like to also say, don't take things for granted. Don't think that it can't happen to you. If you're married, you're with one partner, it's still good to be tested. At least you'll have that information. Hey, I know my status. So please take that to heart.
We talked a little bit talked a little bit about several different sexually transmitted diseases. And it's important to know that there may be no symptoms of sexually transmitted disease. There may be no symptoms at all. But there are sometimes symptoms that can make you think, this is particularly concerning and I should go get checked out. So when you think about symptoms of sexually transmitted diseases, Dr. Etienne, talk to us about what people might experience.
Dr. Monroe, often there are no symptoms. So those symptoms does not mean you don't have an STD. But with STDs, usually you experience a change in vaginal discharge. If you're someone who doesn't really have vaginal discharge and all of a sudden you're developing a discharge, you may have odor, pain, you may notice lesions on your genitalia that weren't there, itching, irritation, you may have abdominal pain. And unfortunately with women, chlamydia is one of the most common STDs that women can contract. And often, initially, there are no symptoms. And sometimes it takes months before you even know that you have this condition if you're not screened. That's why it's important to be tested at least once a year. And in my practice, I see women all the time. Pelvic region or my abdomen. And one of the first things we do is or other or gonorrhea, and it has spread to their pelvic organs, and that's a condition called pelvic inflammatory. So these diseases can have very negative effects.
The good news is that we can easily treat and cure chlamydia, gonorrhea, syphilis when caught early. So that's one of the important things. We can prevent the long-term effects of changing your opportunities to have babies in the future, like your fertility. We can help prevent that by early detection and treatment. We have a couple of questions from our listeners and our audience members in person. If you have any questions about sexually transmitted diseases, HIV, or COVID or RSV that we're going to get to, and step up to the microphone and we will take your question. Our first question from an audience member online, Leah from YouTube asks, will I be able to STD? That's an excellent question, Leah. And some might wonder what's the overlap between the respiratory viruses, right? The viruses that affect your lungs and like flu and COVID and any STD, but we do know that the onset of HIV can have a flu-like illness. So, Dr. Etienne, like you're ready to take that question. How will you be able to determine the difference between respiratory or flu, COVID, or any STD?
That's a good question. And when we look at COVID and flu in particular, they can have some of the same symptoms. But when we look at the flu, in most cases, some type of fever. You have a fever, body aches, significant body aches, and chills. With COVID, you may experience these things, but the people that we see with COVID, especially the fact that we've been vaccinated, the symptoms are not always as severe. So you may just have a sore throat. You're thinking, oh, it's my virus. But that's why it's important to be tested. You won't really know for sure unless you're tested with the flu test and the COVID test. And as far as STDs and HIV in particular, as Dr. Monroe mentioned, HIV, what we call acute HIV, you can experience a lot of those symptoms, fever, tiredness, achiness, just feeling just run down. That can be a sign that you have HIV. So being tested is pretty much the only way you'll know for sure what you have. And there's access to free testing for STDs and still a lot of opportunities to be tested for flu testing. not as many opportunities for retesting, but it's good to be tested to kind of differentiate two things.
Helpful to think about your risk, right? So we're here in August, we're not seeing much flu. We're starting to see an uptick in COVID. A flu-like illness or acute HIV might happen about a month after exposure. And so taking all of those things into account will help your is and how you should be evaluated. Jason from Facebook asks, if the COVID test kits test for the new variants? That's an excellent question. Dr. Etienne.
So if a person is positive for COVID, regardless of the variant, the test will show up as a positive on the COVID test. So you don't have to worry about, oh, if I'm affected by the new variant, these older tests won't detect it, but it will detect whether you're positive for COVID.
Speaking of COVID, Michaela from Facebook asks, I got the new bivalent booster last fall. When will I need a new booster? Dr. Etienne, can you answer that question for us? She got the bivalent booster, when it's available. When will she need a new booster?
And it depends on her situation. If she is a healthy person who has no other medical conditions, that's the key. The most updated booster, she is okay. There will be another booster probably in the next month that will be available for everyone. So if she has not had the most updated booster, then it's time for her booster.
So the bivalent booster sounds like if she got boosted after that, then she is up to date with the most recent available booster. But we should keep our eyes open because in the next 3 to 4 weeks, we should be seeing a rollout of a new booster that's available. And we know that should be available by late October. We expect it'll be available in pharmacies and even prior to that, potentially at your primary care doctors. Okay, so I am going to ask my students if they have a question about student health, sexually transmitted diseases. Maybe you're not asking for yourself, you're asking for a friend. You heard on the street or people say, is there anything, well, you have the experts right here, that your friends might want to know about protecting themselves, about keeping community safe, about staying healthy? Excellent. Stand up and microphone. Introduce yourself if you like, but you don't have to. Thank you so much.
Hi, my name is Kate Freeman, First Night St. Augustine University. My question would be, as medical professionals, what kind of, I guess you could say maybe like tactics or methods do you all use to get a person comfortable to be able to have that conversation, whether it be getting them out to go get tested or possibly having a conversation with their partner? Like, how would you ease a person into being able to talk about this?
Great question. Thank you so much for asking it. I'll start and I'll open up to our panel. So one, I try to normalize it, right? This is not anything that is shameful or I'm asking because I think you in particular might be at risk, but I really ask everybody that I see in my as a pediatrician, anyone who is 13 and up, we're having these conversations. We're about making good choices and protection and getting tested and getting universal screening, which is what's recommended actually by the American Academy of Pediatrics, is that everybody who, 14 and up, we're testing for gonorrhea and chlamydia, and 16 and up, we're testing for HIV, because it is prevalent, because people might not feel they've had any exposure or have been sexually active. And so I think normalizing it and making it important. Another thing that I do often is offer my patients that we can bring in and have the conversation together, because sometimes they find it very challenging to have that conversation on their own, and bringing in a neutral third party to help have the discussion and get people tested, talk about safer sex practices, we talk about so we can have that conversation all together. What other, I want to open it up to Nurse Practitioner Dennison first. What other techniques or tactics do you use to help people feel more comfortable and open up when you're having discussions?
Well, I always encourage patients to sit down with any new partner they may have or considering having sex with, and letting them know that you're going to get tested also along with them, so that it's not that I want you just to get tested. I want us both to get tested. Let's go together. And then it opens up the door for both people to feel comfortable and not have to feel like one person is the only person that needs to get tested. So I do speak to all my patients about, even when patients come in, sometimes they will say, I don't need HIV testing because my partner is getting tested. I let them know you can't depend on someone else's test results for your testing. It's important for both people to have a test result, know that test result, and share those results with your partner before having any sexual contact. So hopefully patients can feel comfortable speaking to someone. And I tell them, if you do not feel comfortable asking someone about their HIV status or if they've been tested, then that may be someone you shouldn't have sex with.
Well said. Dr. Etienne.
And I'll add, I really work to try to normalize sexual health, just as we care about your overall health, your mental health, your sexual health is equally important. Or screening for diabetes, screening for STDs is equally important. And there's no shame in it. I'm going to get the same amount of support because STDs can affect your health, probably more so than some of the other conditions that you can develop later in life. And specifically as younger people who are here now, you are more likely to have conditions related to your sexual health that can impact you for the rest of your life. So it's very important. And be an advocate for yourself and even your classmates and friends. Let them know and ourselves and make sure that we are okay. Because all it takes is one time.
And Dr. Monroe, an important part of that testing also is make sure that any site that you use for testing, use for sex, is also being tested, whether it's vaginal sex, oral sex, or anal sex. Because a lot of the patients I see will say that they've been tested before, but they've only given a urine sample. But when assessing them, they say that they participate in oral and anal sex. So it's important that if they feel comfortable talking to their provider about all the sex that they have, and that those sites are also tested for gonorrhea and chlamydia also.
That's an excellent point. And just to clarify that, syphilis not multiple sites that need to be tested, but specifically for gonorrhea and chlamydia, testing all the sites with which you have. Thank you for making that distinction. Thank you for your excellent question to our students. Are there any other questions from our community members who are here with us today, whether it's our student members, about sexually transmitted diseases, COVID, RSV? I made a mention of RSV. Keep your eyes and ears open for a new vaccine against respiratory syncytial virus, which in you and I, healthy non-infants, non-elderly people, is a bad cold with lots of coughing and snot. But in infants, it can be a cold that causes them trouble breathing and to have low oxygen and to need to be hospitalized to get some breathing support. And in people over 60, it also can cause significant breathing issues and potentially hospitalization. And for the first time ever, for those two populations, we will have access to a passive immunity vaccine that will help protect them during this upcoming RSV season. So if you are in those age groups, those demographics, keep your ears open for that. We have a question from a community member. Thank you so much. Come on out and introduce yourself, please.
Yes, good evening. Thank you so much for your time today and this important information you're sharing. Can you talk a little bit about the increased rates and cases of syphilis and how syphilis is transmitted? And is it also transmitted without actual penetration? Talk about the skin to skin as well.
Thank you so much. What an excellent question. Nurse practitioner Dennison, I'm going to open that up to you. Were you able to hear that question well?
Yes.
Oh, fantastic. Talk to us about syphilis, the increased rates of syphilis.
So syphilis rates have been increasing steadily. I remember around 2015 is when we started seeing primary symptoms of syphilis coming into the clinic. And since that time, we've seen a steady increase across all demographics. The symptoms of syphilis can be absent, but they're the symptoms that are visible. Generally, people may have a primary symptom, which is a painless sore that may be visible on the genitals. That symptom can also be in the mouth. We've also seen a syphilis symptom on the face also. But generally that sore will resolve. And when that symptom goes away, which we call primary syphilis, people may go on to develop secondary syphilis, which is a rash. Generally, that rash can be on the body. It will be on the body. You can also see a rash in the palms of the hand and on the bottom of the feet. And that rash also can go away. So as far as transmission, syphilis is transmitted through sexual contact, with genital contact, and it comes in contact with mucous membranes. So whether oral, vaginal, or anal sex, syphilis can be transmitted through those routes. Syphilis is easily screened with a blood test, and it's easily treated with penicillin. It's important, really, right now in Wake County, that anyone who is sexually active gets screened for syphilis, because the rates are high and you may not show any symptoms of syphilis at all. And you could have been exposed to syphilis at some point and not have any symptoms, but a blood test still can let us know if you've been exposed to syphilis at any point through your sexual history once we do that blood test, because the blood test will detect syphilis antibodies. So it's important to get the testing done, get it treated fully, and make sure that anyone you've had sex with is also treated. And anyone who has a positive test for syphilis, it's important also to make sure that you speak to one of the disease intervention specialists through the state or the county that would be getting in contact with you after having a positive test, because that's how they make sure that you and anyone you've had sex with is treated. But just shaking someone's hand, you're not going to get syphilis from that person. You do have to come in close, intimate contact for syphilis to be spread from one person to another.
Syphilis has been thought of as a disease of older Black men. That is not the case. Because of the Tuskegee experiment back in the 1930s, that's where we saw most of the syphilis cases. I'm sure you all are aware of that. But we're seeing so many cases in people of all ages and all races. We're seeing higher numbers in younger people. In the state of North Carolina alone, we're probably one of the states with the highest incidence or number of cases of syphilis. 2021 to 2022, we've seen over 30% increase in syphilis cases. We've been in a COVID pandemic, we're in a syphilis epidemic. It can happen to you. It can happen to you. We're seeing people younger than you all with syphilis. And all it takes is one time.
Thank you both for that information. That is really helpful. I think people don't hear about or think about syphilis as much. So thank you also to our committee member for that excellent question. And nurse practitioner Dennison, what I understood from you is that contact with the lesion, with the ulcer that is shedding syphilis, mucous membrane to mucous membrane. So when I hear mucous membrane, that's mouth, vagina, bottom, your anus, any of those sources having close contact, which does not necessarily have to be penetration.
Exactly.
And transmit syphilis.
So someone could use their mouth to perform oral sex on someone's genitals, and they can also get syphilis through that route also. That there does not have to be any penetration necessarily to transmit syphilis to someone.
The other thing, Dr. Etienne, thank you for pointing out that we are in a syphilis epidemic and that young people are absolutely at risk and contracting syphilis, is that we're seeing more birthing people contracting syphilis and potentially transmitting it to their and babies. Their babies get tested for exposure. The treatment, luckily, is the oldest antibiotic is penicillin. So if you get tested and treated early, you absolutely can cure syphilis, prevent the transmission spread to other people and your baby if you're a birthing person. A long-term and really bad potential neurological side effects, right? So syphilis can get down to can get so far progressed that it can impact your brain and nervous system and be deadly. So penicillin, prevention, condoms, getting partners tested, treating with penicillin, all of those things can help keep you safe.
And Dr. Monroe, it's important to know that people who, even if you have a negative test and you had a partner who screened positive or tested positive for syphilis, then as a contact to that person, you should also receive the correct treatment for syphilis, because you may be negative today, but a month from now, you may be positive. So if you've had sex with someone and they told you that they tested positive for syphilis, then you need to seek treatment and testing at the local health department.
That's helpful. Thank you for that clarifying information. Okay, we are coming to the end of our session here today. I want to thank our St. Augustine's colleagues and technical support, our Wayne County big applause for Dr. Etienne and nurse practitioner Dennison Thank you all so much. This is just one more installment of a year's worth of work in this series, Ask the Doc Town Hall. And we just want to be here for you, community members. We want to answer your questions. We want to be open and frank. We want to provide you the best and most up-to-date information. We really appreciate you being here and participating with us. If you are here in person, there is a Health Lit for Wake gift bag and the QR code on the board at the front to fill out the survey for Health Lit for Wake, and we would really appreciate that. Otherwise, we are signing off tonight, and we appreciate everyone. Thank you.
Thank you.